To give you something a little bit different today and tell you about something that you may have heard about called contact tracing. I realize that when you hear terms like tracing or surveillance or investigation, those can sound a little intimidating or intrusive. But really, those are clinical terms, and what we mean by that is identification and notification of people who may be at risk of becoming infected. This is all in an effort to improve individual outcomes for patients and to reduce risk of infections for the population at large. Just like we do with many other highly contagious diseases, a person who tests positive for COVID-19 is contacted by a clinician, usually a nurse from their local health department. They notify them of the positive result and provide immediate guidance and answer any questions they may have. After taking care of that patient, the next phase is to identify all of the people that may have been exposed by the patient who is infected. This is sometimes a painstakingly long process, requiring folks to look back through calendars and social media posts and cell phone records to jog their memories on who they may have interacted with during the previous several days. Once a list is made of all of the people with whom the patient may have been in contact, all of those individuals must be made aware of their potential exposure. It's easy to see how this number can get out of hand really quickly, so it requires increasing manpower numbers to handle all of these notifications. Additionally, once people are notified, they're asked to communicate with their health department contact daily for the entire incubation period. You've probably heard that term before, and that's the typical period of how long it might take you to get sick after you've been exposed. For COVID-19, that is generally 14 days. We ask them how they're feeling every day and to report any symptoms they may be having. The staff member can then help facilitate testing of that individual who may be showing signs of illness, and then, if that person tests positive, the whole process starts over. As you may have heard in some of your readings or in the news, testing availability and contact tracing are two key components to help us move forward and restart the opening of our economy. We know that even despite our best efforts at social distancing, our number of positive cases is going to increase when people start interacting more. So it's really important that we bring on more contact tracing staff now to help all of the 89 rural health departments that are served through the Tennessee Department of Health. Through the repurposing of state employees whose workloads may have recently been altered due to the pandemic, we put out a call to all 23 state agencies for staff who would be interested in volunteering to be temporarily reassigned to these duties within the Department of Health. We were incredibly pleased and quite frankly humbled by the response that we got. 230 state employees are now in the process of being trained to handle these tasks, which more than doubles our current workforce for contact tracing. Many of these employees are being trained even today, and some of them will have their first patient contacts before this week is over. We are grateful to these employees and our sister state agencies for supporting us in this impactful work.